Hello, I'm Dr. Kim Young-jin. Before watching today's online surgical video, let me briefly explain the details of the patient. The patient is a male in his 50s. He made a visit with a chief complaint of fracture and mobility in the maxillary anterior region. As you can see in the initial panoramic image, there is a retained root in the number 14 site. The number 15 tooth was missing. As you can see here, the space is insufficient to place 2 implants in the area. Therefore, 1 implant was placed at the number 15 site, and a pontic extension was planned for the number 14 site. However, the main focus of today's case is the anterior region. 4 anterior teeth, number 12, number 11, number 21, and number 22, were extracted. In this case, the use of the OneGuide system enabled immediate implant placement with ideal positioning and angulation. Additionally, to maximize cervical gingival aesthetics in the maxillary anterior region, a dual-zone grafting technique was applied, placing the graft material up to the soft tissue level. This case clearly demonstrates how graft material can be extended above the implant level. Let's take a look at the surgical video.
안 물어보시고요. 힐링 왜 쏘주세요. 네. 물어보세요. 어금니로 딱딱딱딱, 어금니로 딱딱딱딱. 됐고요. 시작하겠습니다.
This is the post-OP panoramic view. As shown in the video, if the anterior implant placement can be fully guided by a surgical guide, I prefer to fabricate the custom abutments and PMMA bridge in advance, especially after performing dual-zone grafting in anterior extraction sockets. Successful soft tissue sealing becomes important. You can shape the cervical contour using temporary abutments and flowable resin. However, for a case involving 2 or 3 adjacent implants, if the cervical contour can be established using custom abutments, I believe soft tissue sealing after dual-zone grafting will be much easier, as shown in the video. And that's why I chose this approach. And then the PMMA bridge was placed over the implant. I wouldn't call this immediate loading, though, because it is better to avoid any occlusal forces on the bridge. As you can see in right maxillary teeth, the implant was placed in an ideal position at the number 15 site, with a cantilever planned for the number 14 site. As you can see, placing 2 implants in this area would have resulted in insufficient spacing between them, potentially leading to long-term maintenance issues. Designing the prosthesis beforehand using a surgical guide for this case, however, allowed the placement in the ideal implant position. As shown here, I often place an additional rescue implant. In this case, although primary stability was sufficient, the additional implant was submerged. It was because it can be immediately used in the event of failure of an implant during the loading process. There may be differing opinions on this approach among clinicians. Filling the socket with graft material can be an option to perform socket preservation, but I chose to place the implant and then perform dual-zone grafting for socket preservation. I believe this approach provides an optimal way to preserve the underlying alveolar bone beneath the extraction socket, that is, the area beneath the pontic base. At 3 months post-op, gingival healing appears to be progressing well. One of the key advantages we've observed with the dual-zone grafting is that it tends to cause minimal gingival recession. Thus, in many cases, the CAD/CAM abutment used at the initial stage can also serve as the final abutment. Therefore, we take impressions at the abutment level and simply replace the provisional prosthesis with final prosthesis. Some clinicians may raise concerns that using a custom abutment for the temporary prosthesis and replacing it for final prosthesis could increase the costs. While this may be true in cases with significant gingival recession, in most other cases, taking impressions at the abutment level is more cost-effective than fabricating a temporary abutment and then discarding it later. As you can see, the aesthetic outcome is not bad. To minimize gingival recession, what I'd like to emphasize most is dual-zone grafting. If gingival recession occurs, abutment replacement may be required, but in this case, the treatment was successfully completed. Thank you for your attention, and I hope to present another insightful case next time. Thank you.